agriculture, renewable fuels, wind and solar energy.
Along picturesque, sprawling landscapes, 20% of the overall population are putting down roots in the rural areas responsible for producing some of the country's most vital resources.
But when it comes to one of our most basic human needs, are the people living and working in America's countryside receiving the full benefits of our healthcare system?
20% of the population lives in rural areas, but only 11% of the physicians actually practice in those same rural areas. So there's half the access available if you're living in a rural area in the U.S. Rural America really is, the old term was the breadbasket of America, but rural America really does provide the resource for urban centers. So it's incredibly important for the people that live in rural areas. But again, I get back to you shouldn't have to pay a price in terms of the healthcare available to you because you happen to live rural.
It's unfortunate we see many people come into the ER that, obviously aren't able to take care of themselves and not even perform the activities of daily living, being able to bathe themselves, being able to even make it to the bathroom. And these are the people that need that preventative health care, maintenance health care the most. We are definitely at risk of decreased health care access here in rural America. And unfortunately, a lot of these small hospitals are shutting down.
We've seen more hospital closures from 2005 until now than we have ever in our entire history as a country. That's incredibly impactful. In addition to that, there are lots of hospitals that are at a point of making decisions about, are there services that the community needs but we can't provide? And that naturally leads to questions of, should we be part of a larger system? Should we let someone take us over? So there's all kinds of trends that are happening. The reason why these trends are so bothersome is that small communities that are connected to their local hospital or regions that are connected to their hospital get the absolute best possible service because you're connected. You understand what your community needs and what your region needs.
I was diagnosed with colon cancer, had stage 3, had my surgery out of town and was able to come back for my chemotherapy and other wound treatments that I had. Through this whole process, there was lots of travel with it, but thankfully at the end I was able to stay home at the end of my treatments and at the end of this whole process, which was a vital time for me to be not having to travel quite as much as I had to that point.
Healthcare in the Heartland is vital and essential to all of us who reside in rural America because it provides us with improvement and maintenance in health and wellness, and also it provides economic stability to our communities. So it's very important. But I think the key point in this is accessibility. Our ability to get care in our homes or near our homes. As for example, if there's an emergency, you can get to an emergency room and be treated when time is of the essence in a life or death situation.
Jamestown Regional Medical Center's origins are really very interesting. The cornerstone for the hospital was actually laid 6 days after the stock market crash that was the beginning of the Great Depression. Right from the onset, the community has said this is how important healthcare really is to us. And it's not just the community, it's the entire region. So if you fast forward through our history, our current location we've been in for 12 years, and when we were planning for this facility, when we thought about what are the services, what does the square footage look like, we really went to the community. So we had a visionary board, we had visionary leadership that went out to the community and said, what do you want and what do you need? And the message we got back was very, very clear. We should not have to drive 100 miles or more to get standard care. I should be able to see an orthopod locally. I should be able to see somebody because I get nosebleeds pretty often. You should be able to see someone for those kinds of things.
In the community, there were 3 different clinics operating. 2 that came out of health systems from Fargo and 1 that came out of a health system from Bismarck. We wanted to provide a neutral place where all of them could work together.
I was at Mayo and had my reversal surgery, woke up, tremendous hole in my side. They were looking for a facility, a wound care facility that I had to come back to, and Fargo was the one that showed up on the radar, and I said, I don't want to go to Fargo. Let's see, and Jamestown had a wound care. Rochester got me hooked up with the wound care clinic here, and it was flawless. They were ready when I showed up and knew I was coming and planned for it and was prepared when I got here, and it went from there.
Your babies can be delivered near home. You can get chemotherapy near home, so you're not driving one way 100 miles to get chemotherapy. And from what I've been told, since 2019, our cancer center has saved patients over 500,000 miles. That's 500,000 minutes of windshield time. So all those things are important. And I also think it's important with regard to accessibility in rural America. It seems to me as though we get in to see our providers in a more timely manner. We get our surgeries in a more timely manner. I have heard horror stories in larger communities where people have waited 2 weeks for their surgeries. So the healthcare here is excellent, and I would hold it up to anywhere in the country. Jamestown is a group of independent, hardworking, caring individuals. That's what our community is. We felt the best way to provide services for our community was to make decisions locally, to know what was happening locally and make our decisions that way. So that's the impetus to staying independent, to working towards building the hospital.
The staff here was absolutely wonderful with how they handled this whole situation. Nothing seemed too big or too small, and they also live with you in the same town. So you see them at the grocery store, you see them when they ask how you're doing yet, with a smile on their face, you know.
Well, every community has this need for specialized care, and 80% of healthcare in a healthy community should be done locally if it can be.
The community benefited from more providers, no matter from which system they came. And what I have seen is, by us working with Sanford to do the cancer center, all of the collaborations that we're going to be doing, all of those collaborations met our vision of providing the best care possible for our community. The way that Jamestown Hospital has been able to maintain stability financially and in all other ways is because of the fact that we developed the specialty clinic. We knew that we would get referrals from the other clinics, but we also needed our own referral source.
Having JRMC in my hometown means a lot, just to be able to have the facilities that you need to get through the biggest problems you face to the smallest problems you face.
Jamestown Regional Medical Center, legendary healthcare.
For more, visit jrmcnd.com.